In this video today, I'm going to be talking about laser hair removal and what to expect during your consultation and your subsequent treatments. Laser hair removal is a method of more permanently removing hair rather than regular waxing or plucking or shaving. Laser energy is used to target the hair follicle, in particular the DNA in the hair follicle, to destroy that DNA and hopefully stop the regrowth of that hair in the long term. Laser hair removal can be used on virtually any hair type except for blonde hairs and white hairs, and it can be used on virtually any part of the body which has hair. The lasers we use are selectively attracted to the pigment or the melanin in the hair follicle, and because the hair has a lot more melanin or pigment than the skin, it tends to focus in on the hair follicle. Now this basically heats the hair follicle up to the point where it denatures or destroys the DNA, which is a protein in the hair follicle. Now without DNA, the hair follicle can't return. Plucking and waxing removes the hair follicle, but it doesn't remove the DNA. A little bit of DNA is left behind and the hair resprouts. So that's why you can only remove hair on a more permanent level with laser hair removal. Laser hair removal needs to be performed on a regular basis for multiple sessions. The reason for this is that the hair actually goes through 3 phases, which is the growth phase, the adult phase, and the dying phase. Only in the growth phase can the hair be targeted with laser, and that's when it is susceptible to laser hair removal. At any one point in time, there will be only a certain number of hairs which are in that growth phase. So generally we need to do multiple sessions of laser treatments to get as many hairs as possible whilst they're in that growth phase. For this reason, it's important to be regular for your hair removal appointments, and also different areas of the body will have different hair growth cycles. So for example, the face may require treatments every 4 weeks, whereas the legs may require treatment every 6 to 8 weeks. So what does laser hair removal involve? We use Alexandrite lasers for those with fair skin, and Nd Yag lasers for those with olive or darker skins. These lasers are specifically used for laser hair removal at our clinic. Other clinics may use IPL machines or intense pulse light machines. Now these are not as specific to hair as our lasers and may have problems with the treatment of darker skin types in particular. Prior to laser hair removal, it is important that we shave the hairs, or you do this at home. If you're unable to do it yourself, for example, if you have hair on your back or some area where you can't reach, we can do this for you. Shaving the hairs has the effect of reducing the impact of the laser energy on the outside portion of the hair, which has no impact on reducing hair growth. What we need to target is the DNA on the inside of the hair, or the hair underneath the skin. The laser beam is basically passed systematically over the treatment area in a systematic fashion so that every spot is covered. For large areas like the legs, it may take a couple of hours. For smaller areas like the face or the chin, it may take only a few seconds. Laser hair removal is not intended to be a painful treatment. In fact, if there is some pain, it is important that you mention this to your operator, as it may be a sign that the settings are too high. During the treatment, we also use a Zimmer cooler, which is a machine that blows cold air across the skin whilst the laser penetrates through it. This machine helps to make the laser treatment virtually painless, as well as protect the top layers of the skin whilst the laser penetrates through that top layer and hits the hair follicle. There may be some redness of the area treated after the laser, and occasionally you see a little bit of mild swelling around each little hair follicle. There may be some singeing of the hairs, and this may cause the hairs to drop out after the laser treatment. Afterwards, you may find there's a period of no hair growth for several weeks, and eventually the hair will start to creep back, but usually at a slower rate, and the next treatment is then performed. Complications with laser hair removal are extremely rare and something that we don't see very often. In most cases, people will be able to return back to their normal activities or work straight away, and there's no downtime. Changes in the skin after laser hair removal are extremely rare. Other unusual side effects include increased hair growth after laser hair removal. This usually is a sign that not enough laser energy has been used during the treatment, and subsequent treatments usually correct this. Irritation of the skin or some folliculitis where the hair follicle is inflamed can often occur after the treatment, and this sometimes gives the appearance of like a breakout in the area. Overall, laser hair removal is a good way of managing and controlling hair growth, in particular in areas where it's inconvenient to constantly shave or wax. It's an effective treatment that can be performed very safely and gives great results.